There was little known about intellectual disabilities in the early 1900s. Research, education, and diagnosis were extremely underdeveloped, and thus early neurosurgeries were extremely deleterious, and they often failed, leaving patients incapacitated and in the utmost pain. One of the most prominent examples of a failed neurosurgery is the lobotomy of Rosemary Kennedy, sister of John F. Kennedy, who was born into the extremely competitive Kennedy household where she and her siblings received vast amounts of pressure to be extraordinary. Rosemary led a somewhat normal and gregarious life, but she still struggled with her intellectual disabilities at times. So after hearing of a new and promising procedure known as a lobotomy that would supposedly help Rosemary, Joe Kennedy, her father, decided to have the lobotomy performed on Rosemary. Unfortunately, this lobotomy drastically failed and left her physically disabled and left her personality forever altered. She was institutionalized almost immediately afterwards and proceeded to spend most of her adulthood in said institution. The story of Rosemary Kennedy is a good example of what early neurosurgeries were like because it shows how, because of the lack of knowledge regarding neurological disorders, many neurosurgeries failed and ruined the lives of the patients receiving them.